She walked into the dental office the same way she'd walked into every doctor's office for the past 3 years, Medicare card in hand, ready. The receptionist ran it, typed something, looked up. "Ma'am, Medicare doesn't cover this." Not the crown, not the root canal that made the crown necessary, not the cleaning she'd skipped because she wasn't sure what it would cost. The card went back across the counter, and the bill, $2,700, stayed. She is not an edge case. 100% of original Medicare beneficiaries have zero routine dental coverage. As of 2019, roughly 24 million Medicare enrollees, 47% of all beneficiaries, had no dental coverage of any kind. The statutory reason has a name: Section 1862A12 of the Social Security Act. It has prohibited Medicare payment for dental services since the program's first day. That's not a bureaucratic accident. That was a choice, made in 1965, and it has never been reversed. 2 questions should be sitting with you right now. First, why did Congress write that exclusion in, and has anyone ever seriously tried to remove it? Second, Medicare Advantage plans advertise dental benefits constantly. Every commercial, every mailer, every television spot aimed at people turning 65. So why are 24 million beneficiaries still getting these bills? When Congress created Medicare in 1965, it was building a program from scratch under intense fiscal pressure. The priority was hospital care and physician services, the acute medical needs that were bankrupting elderly Americans. Dental care was categorized as something separate from medicine, not urgent, not the program's core mission. Section 1862.12 was written to reflect that boundary, and it has been carried forward, unchanged in substance, through every reauthorization and revision for 6 decades. The gap has not gone unnoticed. In 2021, the Build Back Better Act included the most significant proposed Medicare dental expansion since the program's founding, a move toward comprehensive routine coverage that would have restructured the benefit entirely. It stalled in the Senate. The Medicare Dental Benefit Act of 2023 was introduced, referred to a subcommittee, and went nowhere. The only concrete coverage gains in recent years have come not from Congress, but from CMS rulemaking. Narrow regulatory expansions covering dental work described as inextricably linked to procedures like heart valve replacement, organ transplants, and certain cancer treatments. That is the full extent of what has changed. The exclusion was a budget decision. It has survived every political cycle since. Now to the second question, the Medicare Advantage dental benefit and what it actually amounts to. The average annual dental maximum in a Medicare Advantage plan reached $2,309 in 2024. That number has been rising, up more than 9% from prior years, and the television commercials have noticed. What the commercials don't explain is what $2,309 buys when you actually need dental work. A single porcelain crown averages $1,399. A molar root canal averages $1,337. A beneficiary who needs both in the same plan year, a common clinical sequence since root canals typically require crowns, has likely consumed their entire annual dental benefit. Every dollar of dental care after that point comes entirely out of pocket. Here is the structural nuance that most people miss entirely, and it matters more than the cap itself. The dental annual maximum is separate from the plan's medical out-of-pocket maximum. Hitting the dental cap does not count toward the plan's MOOP. A beneficiary can have a year with significant medical expenses, hospitalizations, specialist visits, procedures, and still face 100% out-of-pocket costs for every dollar of dental care beyond the annual limit. 2 separate tracks running simultaneously with no crossover. Coverage is also not uniform across plans. One plan covers only preventive care. Another plan covers major services but adds waiting periods before those benefits activate, network restrictions that exclude your current dentist, and higher cost sharing on restorative work. Many plans do cover cleanings, exams, and x-rays at low or no cost. The gap is sharpest for major restorative work, not basic prevention. Implants appear in some higher-tier options, but the fine print varies sharply enough that no general statement covers all plans. What the advertisement promises and what the evidence of coverage delivers are not always the same document. So what does the bill actually say? In numbers, for someone on original Medicare with no supplemental dental coverage, a crown runs $800 to $2,500 without insurance, with a typical porcelain crown averaging $1,399. A root canal runs $700 to $2,100, with a molar averaging $1,337. Basic dentures start around $452. Complete dentures run $1,835 to $2,083 per arch. Implants average approximately $2,695 per tooth. All-on 4 procedures average $15,176. Full mouth implant work reaches approximately $40,000. These are not worst-case projections. These are averages. The population-level consequence is measurable. After turning 65 and entering Medicare, beneficiaries show significant decreases in dental service use, fewer restorative visits, and a documented rise in tooth loss. AARP found that 1 in 5 older adults delayed or went without dental care in the past 2 years, most citing cost or lack of coverage. The average out-of-pocket dental expense for Medicare enrollees who needed care was $607 in 2016, a figure that understates the real exposure because it averages in everyone who simply did not go. The people who skipped the appointment are counted as having spent nothing. They did not spend nothing. They spent their teeth. What does your situation look like specifically? Have you run into this gap, a bill you did not expect? A benefit that ran out before the year did? That question matters, and there is a place for it at the end of this video. Now, the realistic options, not oversold, not undersold. If you're enrolled in Medicare Advantage, read the dental evidence of coverage before the plan year ends. Specifically, the annual maximum, what the plan classifies as preventive versus major, whether waiting periods apply to major services, and whether your current dentist is in the network. These are not small details. They are the difference between the benefit you think you have and the benefit you actually have. Standalone dental insurance exists for Medicare beneficiaries outside of Advantage. Premiums, waiting periods, and annual caps require the same scrutiny. A plan with a $1,000 annual maximum and a 12-month waiting period on major services is not coverage for a crown you need this year. Dental discount plans are not insurance. They offer negotiated rates at participating dentists, useful for predictable, lower-cost care, but not a substitute for major procedure coverage. Know what you're buying. Dental schools provide supervised care at significantly reduced cost. For beneficiaries in metro areas, this is a practical option worth investigating before a procedure, not after the bill arrives. Medicaid is the safety net that many Medicare beneficiaries don't realize they may qualify for. Seniors who are dual eligible, enrolled in both Medicare and Medicaid, may access crowns, root canals, partial and full dentures, and extractions at low or no cost. Benefit generosity varies significantly by state, but for those who qualify, this is the most comprehensive dental coverage available within the Medicare ecosystem. Finally, the narrow original Medicare exception. Dental work that is inextricably linked to a covered medical procedure required before heart valve replacement, organ transplant, or certain cancer treatments may be covered. If you are facing a major medical procedure, ask your treating physician explicitly whether any required dental work qualifies. Do not assume the billing department will raise it. Ask the physician, in writing, if possible. Return to the woman at the front desk. The $2,700 bill. The shrug from the office manager who had delivered that same news many times before. She was not unlucky. She was statistically normal. One of 24 million Medicare beneficiaries without dental coverage, living inside a gap that was written into law in 1965 and has survived every serious attempt to close it. Congress came close in 2021. A standalone bill in 2023 went to a subcommittee and stopped. The only concrete gains have come through CMS rulemaking, narrow, incremental, not the structural fix the gap requires. The Medicare Advantage dental benefit is real, but limited. A $2,309 average annual cap that one crown and one root canal can nearly erase. running on a separate track from the plan's medical out-of-pocket maximum. The system is not broken. It is working as designed. Protecting yourself means reading the fine print before you need it, knowing the Medicaid safety net exists if you qualify, asking your physician explicitly about the medical exception before major procedures, and treating every television ad promising free dental with the same skepticism you'd apply to any offer that sounds too good to be true. This is an independent educational channel. It is not affiliated with, endorsed by, or connected to any insurance company, the Centers for Medicare and Medicaid Services, or any government agency. Everything here is general information only, not legal, medical, tax, or financial advice. For decisions about your own coverage, talk to a licensed insurance professional or a state health insurance assistance program counselor in your state. SHIP counseling is free. If you've run into this gap yourself, a dental bill you didn't expect, a benefit that ran out faster than the advertisement suggested, a plan that covered less than you thought, say so in the comments. Specifics help other people recognize their own situation. If this is the kind of explanation you want before the next bill arrives rather than after, subscribing puts the next one in your feed. That's the only reason to do it. There are related videos on Medicare Advantage fine print and enrollment traps linked from this one. Watch those before your next plan year decision. She left the dental office that day with the bill in her hand and the card in her wallet. The card that, for this particular expense, in this particular office on this particular Tuesday, did exactly nothing. The coverage gap didn't surprise the office manager. It didn't surprise the insurance actuary who priced the plan. The only person it surprised was her. That's the gap this channel exists to close.